Tim saw his doctor when he was sick last month, and now he's receiving stuff in the mail about it. He's confused by all the paperwork. His wife Lisa walks in and sees he's frustrated. "It's not as confusing as it looks, Tim," she says. "But I can't figure out how much to pay," says Tim. Lisa explains that the health plan sends an explanation of benefits. It's not an actual bill. It states how much the doctor can charge them under their health plan. Tim still looks lost. Lisa tells him that after a doctor's visit, their doctor sends a claim to their health plan. They process the claim and determine the allowed amount. In other words, the maximum amount the doctor can charge for the service under their plan. Sometimes the allowed amount is called the contracted or negotiated amount. Since our doctor is part of the plan's network of providers, we pay less because our doctor has an agreement with the plan. Tim likes the sound of that. Lisa goes on to explain they haven't met their deductible yet, the amount of money they need to pay out of their own pocket before their health insurance starts paying for care. So their health plan will put the allowed amount toward their deductible. If they'd already met their deductible, they'd pay only a percentage of the allowed amount called coinsurance, and that only continues until they reach their out-of-pocket maximum, the most they'll have to pay before the plan begins to pay 100% of the allowed amount. "Whoa, deductible, coinsurance. Slow down," says Tim. Lisa explains it like this. "Tim, let's say our plan's allowed amount for your doctor visit is $150, and we've already met our own deductible for the year. Our coinsurance of 10% would be $15. Our plan pays the rest." "Okay, I think I'm getting it," says Tim. "And this," Lisa says, pointing to the letter, "is the amount our health plan says our doctor will be charging us. When we get our bill from the doctor, we just need to make sure this amount matches the amount on the doctor's bill." "But," says Tim, "I already paid part of it the day of my visit." "No problem," says Lisa. "Then the bill should come in with that amount subtracted from it, and we send our doctor the payment for the rest." "And that's it?" Tim asks. "That's it," says Lisa. "Well, that's not too hard to figure out, I guess," Tim says, "but I'll still let you handle the medical bills from now on." "Sounds good," says Lisa, smiling. Although MCHCP doesn't directly handle claims, we do want you to have the very best information. If you have questions about your claims, call the number on your medical plan ID card. For billing questions, call your doctor directly for help.